What's up, guys? It's Q with some more tips, tricks, and hacks. Today, I want to talk to you about infraspinatus. The infraspinatus muscle is one of the rotator cuff muscles, and a lot of times you'll feel that pain right back in here and down the back of your arm. A lot of CrossFitters get it with snatching, handstand push-ups, and things like that. I've seen a few guys that just quit CrossFit altogether because of the pain and issues that they had with this. Obviously, they didn't talk to me because I could have helped them out and I could have got them back in the game, no problem. But it is one of the most annoying muscle injuries, and it just aches on the back of your arm. It can also come to the front of your arm sometimes, and also set off some other muscle injuries in that area, in the rotator cuff and other muscles that compensate and help. But it is a pain in the butt. But I got some great tips for you guys today. Just stay tuned, and my last one will probably be one of the best ones that I use personally. So here we go. Okay, my number one go-to right here. This lacrosse ball and I have gone through a lot together. You've been with me through the hard times and through the challenges. I'm sorry. Anyway, so this lacrosse ball, you basically put it right back in there on the back. You can actually put it in a sock, throw it over your shoulder, lean up against a wall, and let it work in that area. What you want to do is you want to find those spots that just light you up. When you feel it, you'll sometimes feel like a referral pain down the arm. It could even go all the way down to your pinkies. That's how powerful this muscle is. I mean, I've seen people suffering, thinking that it's nerve damage, that they have herniations in their neck. But you sit there and you just work that muscle all the way through. But you want to hit right along the shoulder blade, right in that area, along the rim of that bone right there, the scapula. And just let it sit on those spots and let it rest right on that spot. And let it sit there right on that trigger, which is lighting up your whole arm. Just rest there for a minute or two. Move on to another spot, do it again, keep on doing that until you release all those trigger points. And I got some other tricks. Here you go. Okay, the foam roller is awesome. It's not as specific as the lacrosse ball, like I told you, but it is a great tool to help release that muscle. When you're on that foam roller, if you notice, I'm bringing my arm up and I'm actually rotating. It's kind of an active release. You're actively moving the muscle and releasing it on that foam roller. So you're taking the fascia that lines that muscle, making it glide back and forth, because sometimes it'll get restricted and adhesed to that muscle. So we're breaking up that tissue, really loosening it up. Great idea, great move. I love doing this. You want to be proactive with this injury. You don't want to wait till it gets really bad, all right? So this is a really good stretch for the infraspinatus. If you see, you're putting your arm in those positions. But the sad thing is that it bothers me that most places you go, or therapy places, they'll tell you, oh, stretch for 10 seconds, oh, stretch for 30 seconds. That is not doing anything for the fascia or that tissue to actually release. You want to hold these stretches for about 1 minute to 3 minutes. I have all my patients hold these stretches for long periods of time because you want that fascia to elongate, stretch out, break up a lot of those adhesions that are in there. So you hold these stretches like I'm showing you for about 1 minute. You don't want high intensity holds. You want about a moderate hold. You feel the pull, but it's nothing crazy. And then change position to another position. You'll encounter that block, that restriction, and just hold it there as well. Okay, these are great stretches, but you have to hold them for 1 to 3 minutes. Okay, that's the breakthrough. Okay, this is how I like to do the kinesio taping, the rock taping, whatever I like to do. I like to put those bands right across and almost assist the infraspinatus muscle. That brings your arm back just like this. That's its job, is to bring your arm back like that. So I put that tape on there in a shortened position. So the muscle's in its shortened position or down into the back like that, stretched out or locked in like that. So it's contracted. The muscle's on its contracted position, and I add tape there. So whenever the muscle gets elongated, it wants to recoil to help the contraction of that muscle. I'm not doing it for blood flow or nothing like that, okay? I'm just doing it for almost like a muscle assistance, all right? Lastly, here we go. This is that dry needling, guys. I'm telling you, this is a game changer. I use it on myself. I look creepy because I'm sitting there with needles in myself all over the place. This is a hard one to get to, but I do it on all my patients, and they do so well with it. It's like a quick breakthrough. I mean, I get some patients that are 2 or 3 sessions of needling, and they're great. They're good. My athletes, it is amazing the break that people get with dry needling. I like to turn up the intensity really high and just get that muscle really pumping. It helps to fatigue out the muscle spasms, helps to loosen up that muscle. Those needles are basically puncturing in creating new blood flow because your body senses as a new injury. So it sends that blood flow there to bring the inflammation down and to work on the area to fix it. So it's a great idea, a great tool that I use, and it's my favorite tool to use. All right, guys, God bless you. All right, guys, so physical therapy is my passion, and I want to keep you guys in the game, doing it as long as you possibly can, hopefully working through injuries. Guys, so support me and like and subscribe. God bless. Bye.